Colleagues, welcome online, like your cap, Peter, and welcome in the room. We're joined by a colleague of ours who we met in the last couple of years, Professor Amrik Sohal, who several of us went to Prato, to a great conference that he organised, not just because it was in Prato. We worked hard, actually.
Absolutely.
And it was about really the future of healthcare. And we realised how many overlapping interests we have. So Amrik is professor in the Department of Management at Monash Business School. He looks at operations, innovation, supply chains, and the circular economy and sustainability, all of which in various ways map to our work, which you've been discovering since you've been here, Amrik. He's got a PhD in operations management from University of Bradford in the UK, along with a Bachelor of Engineering and an MBA. He's received funding from ARC, Australian Research Council, state and federal governments, and other industry-type associations. And he's one of those boundary riders in academia, but outreaching applied research to other industries. And he doesn't just work in health, he works across other industries. So that really resonates with us because we are an applied research group. Mm-hmm. So all of what I've just said is sort of putting on light bulbs in the heads of people online and in the room. So a bit about us first. So we'd like to acknowledge the traditional custodians. Here, it's the Wallumattagal people of the Darug Nation, and there'll be a different clan in your normal place at Monash. Thank you, Chrissy. Just a bit about us. There's a big bunch of us, 322 people at last count. We've got all these research centres making up our institute, and what you see on the tin is what you get. A whole lot of work on healthcare. You only notice health and medicine is in all the time.
And we've got some appointment for you to meet with Henry's economics team.
Great, thank you.
Yeah. And we're in two faculties. So we're in the Faculty of Medicine, Health and Human Sciences, most of us, but the Faculty of Macquarie Business School, the Faculty of Management, houses the Macquarie University Centre for the Health Economy, and they're part of our institute. So we're actually in both faculties. So that'll appeal to you. Got about 60 million in projects under our management and another 100 million where we're investigators on other grants. 160 projects, and last year we published 514 research publications. And Amrik, as a special treat for you at the end of today, we've got a multiple choice exam on the papers we published last year for you.
Fantastic.
And we're hoping that you'll pass. So that's the sort of numbers. Got a big research cohort, a whole lot of young doctors in training who are going through their MD, who we also provide teaching for, and we do their research supervision, most of their research supervision. And we're very international. About a third of all our papers have somebody in another country involved. And you'll notice one of the dots, several of the dots are in India.
Yeah.
And our MD students go to India for their additional training for one of their semesters. So we've got a lot of tie-ins. We know we're going to talk about India. And then we publish we pitch our studies for high impact journals. And we, as I said, we're very collaborative. Every one of our projects has a partner on the other end of it. So that's enough about us. This is really all about you now. Can we, of course, give you a warm welcome on our collective behalf? Thank you for presenting. And over to you, Amrik. Yes.
And so just click back onto this screen.
Yeah. Fantastic. Thank you very much, Jeffrey. Yes, we did work really hard in Prato. It was really hot. that time of the year, June, middle of June. Yeah, we're thinking of doing it again. So we'll tell you a little bit more about it later on. So thank you for that introduction, Jeffrey. Fantastic to be here. It's my first visit to the institute here, although I have been to the Macquarie Business School before, once or twice, over the how many? Well, I moved from the UK to Australia in 1988, first joining the University of Melbourne Business School. And 91, I switched over to Monash, and I've been at Monash ever since. So it's a long time since I've been at Monash University in the Department of Management. How many of you have been to India? 1, 2, 3 people. Okay, fantastic. You're from India. Yeah. So you'll be able to correct me if I'm wrong in some ways. So as you know, I sort of my operations management background and 13 years in manufacturing industry, I learned a lot about quality improvement and so on. In fact, my MBA dissertation was on quality circles when they became popular in the West in the late 70s and 80s and so on.
Some of our earliest papers, some of us, was on quality circles.
Yes, fantastic. Yeah. And I really got interested in, quality improvement and so on. And the rest is sort of history. Around about 15, 20 years ago, I jumped into the health sector. I looked at the automotive industry, quality improvements and lean Toyota production system and so on. And found out, many hospitals were adopting, lean thinking and so on across Melbourne. So we first had a grant involving Melbourne Health and a couple of other health organizations on, what was happening in hospitals, adopting lean thinking and so on. And then a second project in 2014, which was nearly $1 billion from the ARC, working with people that Jeffrey, Halina Teed at Monash, and another of my colleagues and so on. So finishing that project in 2019, I started to look at India. That's where I'm originally from. I'm from north, from the Punjab, up here, a city called Jalandhar. So I've been going back every year, sometimes a couple of times a year. It's a big country, as you know. It combined is the population of the Americas and the EU. So how do you manage a huge country like that, and how do you address all of the challenges the country faces in terms of healthcare improvement and so on? So we're talking about 1.4 billion people, and took over China this year as the largest country in the world in terms of population. And it overtook Japan as well this year in terms of the economy. It's the fourth largest economy in the world now, $4.2 trillion GDP, but per capita GDP is pretty low still. And the huge disparity, if you like, inequality in terms of the rich and poor. The top 1% of the people in India hold 22% of the income, if you like, yeah. And in various reports, such as the inequality report, India stands out as a poor and very unequal country in terms of rich and poor, and access to things, including healthcare and so on. Other things that stand out in terms of what's happening in India: 2024 corruption perception index, 96 out of 180 countries. So corruption, I guess, is a challenge, as is in many other countries as well around the world. So the country faces extreme income inequality and so on. So how do you deal with a big country like this? I was in India 2019, my first visit with a team from the UK and Australia, visiting various hospitals, trying to get into the sector there and establish such partnerships and so on. And that's what I'm going to talk about really today, how, what we've been doing and what progress we've made and what the challenges are, if you like, in terms of undertaking some research. That was a very interesting visit. I'll touch on some of the places we visited. And then in 2020, we were there again in February, and I was this close to not getting on the last plane out of Delhi. We were actually, at 2 a.m. flight, I think. It was a Thai Airlines flight, and I was very lucky with my wife to be able to get on that flight. And my other couple of colleagues from the UK, another one from Australia. Hey, we managed to come down from a place called Rishikesh, by car. Took a whole day to get to Delhi and stayed at the hotel, in the Aero City. And by the time we got there, nobody was even willing to touch our suitcases.
Oh,
And we stayed in the hotel one night, not allowed to go out of the room. Meals delivered to our room and so on, and got in the taxi next morning. As I said, the taxi driver wouldn't even help us take the suitcases out, touching our suitcases. So, we nearly got caught in 2020. And, there's a lot of migrant labor from other states working up in Punjab and Delhi and so on. And, thousands of people, tens and hundreds of thousands of people were left, stranded, if you like, and they wanted to go back home. And many worked, hundreds of miles to get home. But the good thing is that, at least in the first wave, India did very well handling the COVID pandemic and so on. Overall, 44 million, confirmed cases of COVID in India, half 530, 31,000, deaths, unfortunately. But India, was very active in developing vaccinations and so on. Didn't rely only on UK or USA, Europe, but it started to develop its own vaccinations and so on, and started vaccination program in early January 2021. And there's some big figures there, what it was able to achieve. I'm not going to talk about these. And it developed 2 of its own vaccinations during 2021, and did really well. So this talk is not about vaccination or COVID, but it did face many challenges during the COVID period. Some of them are mentioned on the screen there, and I might sort of touch on some of these as I talk about the work that we are doing. Just during that COVID period, we did work with some others, from the UK and so on, India, and we did end up writing a paper published in, I think it's BMJ Leader or something.
Yeah.
BMJ Leader, talking about, leadership, during the time of COVID and so on. And, I think, right at the top, the Prime Minister Modi provided good leadership, I think, during the COVID period, and sort of quite a considerable, distributive leadership, if you like.
Yeah, we had
During that
ScoMo.
period. Yeah. Sorry, say it again?
We had ScoMo.
So that was interesting, and following this, we did do also a series of interviews with the leaders of hospitals, 4 different elite hospitals, and wrote a paper which is currently under review, which I have to share with you later on if it's accepted and so on. So let's talk about the challenges and what we have been doing, and really the idea is, get you interested in doing something in India and other developed countries, South Asia. We do fantastic amount of work. Look at the group here, 350 academics working, researchers working with industry, a fantastic number of, outcomes, papers and so on. And that's not the case for India, only a small number, really good academics and people working at medical schools, end up publishing in top-tier journals and so on. And my passion, desire is to collaborate, and learn from the Indians what they're doing, and work together to see if we can make a difference, there in my country. So one of the biggest challenges is shortage of professionals, especially in rural areas. With a population of 1.46 billion, we only have about 5.76 professionals working in the health sector, divided amongst those figures there. We're talking about 5 to 6 doctors per 10,000 population, which is way below, the WHO, which is around 40 or something, isn't it? I think. And a big problem in terms of, distribution of these professionals. Most of them want to work in the big cities. Yeah, they don't want to go to the rural areas, in smaller second tier, third tier towns, because it doesn't suit their lifestyles. Their kids can't go to a good school, in these small towns and so on. So skills deficiencies and insufficient infrastructure for training of doctors and so on. There are still, compared to population, only a small number of medical schools, if you like, across the country. Only recently, the top elite medical, colleges are being established. This is under the label of All India Institute of Medical Sciences, AIIMS, but the original Delhi AIIMS established in the early 60s, I think. So a huge, a challenge here in terms of workforce. The other challenge is related to gender. Only about 14% of the doctors are women. Across India. I'm not quite sure what the breakdown here in Australia is. Does anybody know?
It's 60% female.
Oh, wow. Okay.
And in Scandinavian countries, it's 80% female.
Wow.
Entry into medical.
Yeah. So in terms of, the gender gap report mentioned there, India ranks 131 out of 148 countries. So we got a lot of work to do in terms of, women empowerment, broadly, but especially, in the healthcare sector. I think almost all, if not most, of the top jobs, which is the directors of these institutes, medical schools, AIIMS, I'm referring to, they're all men. Okay. So a lot of challenges there, and quite a lot is being done by the government in terms of women empowerment in many sectors, including in the food sector and so on. Another area of my work is food supply chains in India, and so on. Challenge number 2 is the demand is so huge. Everybody wants to go to the top hospitals. I'm talking about the public hospitals here, by the way. Although I have visited a few private hospitals by research and the workshops, etc., that we have run, we've sort of stayed away from the private sector for a number of reasons. But there are excellent, doctors at the private hospitals. Jeffrey knows some of them, and no doubt at the public top tier, the AIIMS hospital. The doctors and nurses are world class. Okay? People from overseas, go to AIIMS for their treatment and so on, and they're very well known and regarded globally. So it is very, very difficult to predict demand because you just don't know who's going to turn up next day. The Indian Constitution says that anybody who walks into the gate of the AIIMS hospital in Delhi has to be seen. The cost is only 10 rupees or something. Okay. And the same with other top tier hospitals, which I've visited a number of times now. You might get 10,000 or 15,000, patients walking in to be seen during one day. So you see images like this, which is patients walking or coming from 200 miles away. Public transport, they come a day earlier, they sleep, somewhere around the hospital, on the pavement. And some of them come because of, fear of missing out on a possible appointment. Some hospitals have introduced, electronic appointment system. I'm told that even though your appointment is made at 2 p.m. the next day, people will come in very early in the morning, and clog up the system, if you like, just, fear of missing out the appointment and don't know when the next appointment might be. And what you also see is, in the image here, is a lot of family members will come to the hospital with the patient, and they will stick around, for the whole duration of their stay. And again, clogging up the system, if you like, and issues of, safety and quality and so on. And you see in this photograph, bottom left-hand, somebody is on the floor having a nap, if you like, with a blanket. Somebody on the bottom right-hand side, having their meal, there as well. So it's very, very difficult to control all of that, even with an appointment system and so forth. So demand exceeds supply. Very, very difficult to manage all of that. Scheduling is is quite a task and so on. The next challenge I want to talk about is the level of certification or accreditation of hospitals. 2022, in my searching various websites and so on, there were 217,000 public health facilities across Australia, and only 17,000, that's about 8%.
India.
Sorry, what did I say?
Australia.
Oh, sorry, India, yeah. So my old age coming in now. Yes. So less than, I think it's about 8%, that have been certified in some way by NABH and other sort of standards bodies and so on. So it's a huge task. You go to this, second tier, third tier cities where hospitals operate without any oversight, if you like, in a good way, and most are not certified. So there's a lack of standardization, if you like, and there are errors and quality safety issues that remain undetected and resolved, if you like, at the front line. So your research on safety, where sometimes you go and you look around and you think, my God, what is going on here? It'd never be allowed here in Australia. And that, because that huge demand, doctors and everybody's so busy, and you say, well, why did you, start a quality improvement initiative of some sort? They said, well, we just don't have time. We're just too busy seeing all the patients that come in, and that sort of whole culture of continuous improvement is not there. But we see some good examples. This in 2019, the first visit was to my home state Punjab, to the Sikhs' holy city Amritsar in Punjab, the Golden Temple. You might have seen some photographs, and a nice little hospital there. It's an AIHI hospital where they've done wonderful work in terms of adopting some of the safety and quality good practices, and have been accredited by NABH. And they focus on standard operating procedures and so on. I took some pictures of what was on the walls there, and they worry about their waste and so on. As you know, hospitals produce a huge amount of waste here, medical waste. Hospital waste is a big problem in India and in Australia and many other countries as well. Another institute we visited in Chandigarh, which is the capital city of the state of Punjab, for the Postgraduate Institute of Medical Education and Research. Is comparable to the AIIMS hospitals across India now, and it was opened by, as you can see the plate at the bottom, by the Prime Minister at that time, Jawaharlal Nehru. Nehru was the first Prime Minister of India after independence, and this was opened in 1963, July 7th, and so on. And they got, I think, good practices. So there are some excellent good examples at a handful of, or a few hospitals, but the large number still have a huge way to go. And then that's a team visiting there. And you see at the top there, right at the top says a campaign they had going was, no shaking hands, because that spreads diseases and so on, And you greet by saying namaste, rather than shake hands and so on. So no handshake, only namaste. Handshake, helps with safety and spreading of disease and so on. Now, my background is all about quality, process improvements and so on, and implementing all sorts of tools and techniques to solve problems, quality problems, and improve process and so on. We have held workshops at a number of hospitals. Most of this work has been in North India, with AIIMS Delhi, the PGI, in short, in Chandigarh, the new hospital, new AIIMS hospital built up in Jammu. And now every state across India more or less has the AIIMS hospital. And these new investments are like, $1 billion investment. So I made several visits now to the new AIIMS hospital in Jammu, and got very close to many people there at the top. But the recent incidents, there up in Jammu, Kashmir, meant that I can't go this year. the Australian government says, not to travel to Jammu and Kashmir region. But that's a $1 billion greenfield site, where this new hospital has been built. A whole township has been established, including, residence for every doctor and nurse, sports facilities, et cetera, et cetera. It's a wonderful facility to go and see what they've been able to achieve. And I'll show you some images on what we've done there. So we've had these, workshops. People are interested. They're very keen to have you there and listen to you and, develop collaborations and so on. We identify pilot projects that could be undertaken and say, okay, we'll come back in 6 months or a year. We want you to start these pilot projects. Let's work together and develop them as demonstration projects so we can showcase to others what can be achieved. You come back, and you follow up in a few months' time, and nothing's been done, unfortunately. And the same response is, we're just too busy. Can't do that. So what is required is a foot on the ground there, to hold hands and get these projects started with a bit of funding if we can provide it. So that's an ongoing challenge, quality and safety and process improvements and so on. So this is again in Chandigarh, one of the newer wings of the PGI hospital, we call it, Postgraduate Institute. And that's the Nehru Hospital Extension, where we went and we've had meetings with these are all senior, people from the hospital, below the top position director. So we've got like the medical superintendent there, and we got most of the heads of departments there talking about, process improvements and quality improvements and, all the work, you're familiar with doing yourselves here and introduce them to, thinking about the problems they have, allocate some time to identify problems and solve problems using the very simple of tools such as the cause and effect diagram. And we've also been to some local universities. This is again in Amritsar, Guru Nanak Dev University, quite a long established university now, in the business school, where we have run again, workshop on quality and safety improvement, in the healthcare setting and so on. And we've had people from, the AIHI hospital I mentioned with taking part, and other hospitals and so on coming together. And this is a photograph taken from that AIHI hospital, where, as I said, probably the best example I've seen in North India of a smallish hospital that have really, done fantastic, I think, in process improvement, safety issues, and obtaining the accreditation and so on. Now, moving beyond simple quality improvement to a whole hospital approach, in terms of lean thinking and so on, you don't see very many examples. Here in Australia, our hospital started adopting lean back in 15 years ago, I think. I know the Victorian government, Department of Health, established a branch, if you like, in terms of lean thinking and so on, and started providing support to hospitals. But in India, it's still relatively new as a concept. Only a small number of hospitals are applying it. Broadly, awareness of lean, application is low. Hard to get leadership to be involved and agree to doing something, and lack of resources as well. But we have seen, we've done the groundwork, which is again running workshops and so on. This workshop was run up in Jammu at the new AIIMS with the team from the UK and Australia, and we focused on lean, green, and digital hospitals. So right up front, this is new hospital, as I said before, greenfield site, new staff recruited, right from across India. Lots of challenges in terms of the human resources, because which is probably another time I would talk about that. Recruitment of staff from South India, if you like. Many of them never been to North India before, and many of them left their partners and families behind. So they're all on their own, across the country and other challenges like that. Uh, and in terms of, being green, new construction, they've really done well in terms of using modern methods of construction of the hospital and modern materials in constructions, as well as, buying the latest technologies and digital systems and so on being adopted. So this will be a fantastic place to visit if you're ever interested in, a top tier hospital in India. Go up to Jammu. And the other interesting thing they've done is, so India has, in terms of universities and business schools and hospitals, so the top tier are the AIIMS, the hospitals. And then in terms of business schools, they call them the Indian Institute of Management, okay, IIMs, and several of them across India now. And then you have IITs, Indian Institute of Technology, which offers undergraduate and graduate, courses, including in management. The IIMs are only, postgraduate schools. So Jammu is the only city, I think, in India that has an IIM, an IIT, and an AIIMS. Okay, and three of them have signed an MOU to work together on research projects, and they've also launched together an MBA on healthcare management. Okay, and that's going really well. And it's a good city to visit and visit these three institutions and see how they work together. I don't think there's a MBA program here in Australia on healthcare management, although there are several masters of healthcare management that are offered. So we've done these sorts of things, at a hospital, at a university. This is working with Chitkara University near Chandigarh in Punjab. And actually, we did run this at a private hospital, the Fortis Group. I know your connections are with Apollo Group.
Yeah.
But this is with the Fortis Group in Mohali, which is sort of a twin city with Chandigarh, and good response from Fortis Hospital. But as I said before, follow-ups, after you've done something is a challenge. The next challenge I want to talk about, and then we can have a bit of a discussion on a couple of few slides. Pharmacies and managing the supply chains. I think there's much improvement needed there. Pharmacies are often run, by an outside sort of organization. Contracts are provided, and I have heard, there are, quite a number of challenges there in terms of, these contracts being awarded and so on, and how these pharmacies are run and so on. And I think there's a lot of improvement that can be made there in terms of modern methods of, pharmacy, warehouse management that can be adopted and so on. I know there that India is now one of the largest producers of pharmaceutical goods and so on, exported all around the world, including to Australia here. But you see images, when you walk down some of these hospitals into the pharmacy area warehouse, compared to, my visits to Monash Health and their brand new, multi-million-dollar new warehouse, quite close to where I live in Melbourne. It's a fantastic facility. But here you see still, one person will be running, a store. This is the story not only in India, but, the whole Indian subcontinent. I was in Sri Lanka, a couple of years ago, and I visited, one hospital where, you saw an image like this, and there's one person running it, and, he's the person who knows everything, he knows where everything is, but, nothing is recorded anywhere, right? So what happens, if something goes wrong? So I think systems improvement, in this side of the hospitals, it's is a need, I guess, and so on. Now, the big push in India is on the digital side and other programs to provide access to healthcare for everyone. So Ayushman Bharat Digital Mission aims to develop a system that's integrated and so on digitally, and provide access to everyone and so on. So I might ask our friend here from India, what does Ayushman mean?
I have no idea.
You have no idea. Well, I heard of it, but I looked it up. It means long life, I think. Long life. Bharat is the name for India in Hindi, I think. Yeah. So it's long life India. I think that's what it sort of means. So it was launched as part of the national health policy in 2017 to achieve universal health coverage for everyone, and so on. And as part of that, there are a couple of things provided. There's a big overhaul of what India had previously. The primary health centers and sub centers and so on. They've all been transformed to what is now called health and wellness centers. There are 150,000 of these across India. Okay, so everyone goes, if something wrong with you, you first go to these centers and so on. You're diagnosed by a nurse or a doctor there, and then you're referred to one of the major hospitals in India and so on. So systems are developing and so on, as well as now sort of health insurance provided on a needs basis, for the poor and so on. So you now have access to something like, as a family, $10,000 per year. I think 5 lakhs, that's the Indian way of measurement lakhs and crores. So a lakh, my calculation is about 2,000 Australian dollars, right? So that's about $10,000 per family per year, for coverage of your expenses at hospitals and so on. So everywhere you go, even now in the villages, that you have various programs, relating to health improvement and so on, promoted by the Prime Minister, as well as you see images of Mahatma Gandhi as well, promoting all sorts of healthcare initiatives. So lots of initiatives, lots of programs, and lots of policies, and comment has been made to me is that in terms of implementation of those policies, that remains a big challenge. And you start you start translating a policy into some practices, if you like, and often there are changes to the policy made. Policy changes are coming in too frequently, and I've heard that you don't have enough time to implement something properly before a change is thrown at you into the policy and so on. Here's another image with people from the UK and so on. We ran leadership, healthcare leadership workshops and so on as well, and operational excellence and so on. So this is from 2024. We had a couple of years of break, not going to India because of COVID. Didn't go in 21 and 22. Then I went back on my own, I think in 2023, just to rebuild those relationships, and gathered the team again from Australia and India. Sorry, Australia and the UK to run a series of workshops. And this time supported by the UK government. So we were able to get some funding from the UK government through our partners from University of Newcastle and University of London. And we were able to cover some of the costs of running these workshops, hiring the venue, covering catering, gathering all the people to go. I think we ran 3 workshops on that trip, up in Jammu and in Chandigarh and in New Delhi. And we got a bit of coverage in the media as well. So what I really here to say is join us on this journey, across India, collaborate with us, help to make the whole global healthcare system a better system. Yeah, a huge effort here, obviously, in Australia. But if we can do a little bit also in some of these developing countries, I think, that'd be a good thing to do. Yeah. So, as I said, we do have now 20 odd new AIIMS hospitals that have been built, and there's a huge opportunity there for us to collaborate with them, do some research with them, because they are very passionate people, but they lack resources and they lack time. I think that's the biggest challenge, resources and time. And of course, beyond these 22 Apex tertiary sort of hospitals, the AIIMS group, then there are hundreds and hundreds of thousands of other public and private hospitals in tier 2 cities and tier 3 cities and so on that requires a huge amount of improvement to their systems and cultural change and so on. Many of you haven't even heard of quality improvement systems and lean thinking and so on. A big push, as I already said, on digitalization, electronic medical record type of systems are being adopted and so on. We've done some interviews recently with some help, writing a paper on EMR adoption, across Indian hospitals and so on. My closing points are really, collaboration is essential if we are to improve our systems globally. And I think we need to take our expertise, to India and learn from them as well, because there is a lot to learn on how India does things, because they've, in many respects, they do things better than us. And there's a learning from them as well, and sharing knowledge on technology and everything else and so on. We are planning a workshop in February 2026, just starting. I've got one partner already, which is the University of Warwick in the UK. They have a Center for Organizing Health and Care Research. Some of you may already know these people, Graham Curry there, and we would like others to join us in this journey. And we want to cover many topics. Thinking about increasing healthcare demand. India has been saying, talking about this, young people that they have, 1.46 billion people. A lot of them are very young, but it's also going to have a very aging population as well very soon in the next 20 years, as we have here in Australia. Somebody's doing research here in aging, right? 1 in 4 will be over 65 by 2050, I think, or something like that. And India is going to follow very soon. So it's going to be a huge challenge there. And of course, mobility of these trained doctors and nurses, not only across India, but globally. A huge number of trained doctors and nurses from India go and work in the UK and Europe and here in Australia as well. And that leaves a big gap back in India. How do we handle all of that situation? And I've sort of come up with a few other topics that we might cover in India. So we invite you to come and join us, Jeffrey, and your team. And there's so much to see and do, if you like, in terms of tourism and so on. Visit the Taj Mahal close to Delhi, and I will take you to the Punjab if you wish. But one question. That's a sign I saw on my recent visits. So thank you very much for your time. It's wonderful being here, just to share with you, the sort of work that I do and the current passion that I have to help improve, global healthcare systems, particularly in India.